One.
Good day, I am John James, an EMT attached to the Linstead Fire Department. And today I'll be doing a patient assessment on a medical adult patient. Alright, so a call came in through dispatch that there's a male in his 40s that was doing some work in his yard and then fell unresponsive temporarily. So first, I'll be doing BSI from me and my partner, CVCF, number of patient 1. I will be having ALS on standby and nature of illness, unresponsive, and not looking to take ceasefire precautions at this time. So now informing a general impression of my patient, I can see that I have a male patient of African descent, appears to be in his 40s, who is responsive but appears to be in some amount of discomfort. So now I approach my patient in the line of sight. Good day, sir. I am EMT James, and your name is?
Israel.
Alright, Mr. Israel. What seems to be the problem today while you call ALS?
It's a weak job.
You just felt weak and then you fell. Alright. Do you know what day is today?
It's Friday.
Alright. What's the date of birth?
1980,
Okay, then alright. And you said you were just doing some work in your yard when you fell.
It's weak.
And then you fell. Okay, alright. No problem, I can definitely assist you with that. But in order for me to do so, I need permission to touch you. Do I have your permission?
Yes.
Okay, alright then. So at this point, I'm not seeing any obvious life threats on the patient. So now, the patient was talking to me, so I can see that the patient have a very patent airway. So now I'm going to move on into doing my breathing assessment. So, this pulse ox is just to get the oxygen saturation of the patient. So now in breathing, I'm looking for my rate, rhythm, quality, and depth. So I'm going to look for adequate bilateral rise and fall of the chest. I'm also going to look for the rate. So I'm going to count for 30 seconds and then multiply by 2 to get the rate breaths per minute. And then I'm going to also auscultate. Alright, sir, I want you to take some deep breaths for me. Again. Again. Can you lean forward for me, please? Deep breaths in there. Alright. A patient's lung sounds are clear, and the patient is also having a regular breathing rhythm. Alright, so on the pulse ox, I'm seeing where my patient O2 saturation is 92%. Also, I can see that my patient is using some amount of accessory muscles to aid in breathing. So I'm going to give my patient low flow oxygen, 5 liters via nasal cannula to assist my patient with his breathing. So now I'm going to move on to my circulation. So I'm now going to check pulse, checking for rate, rhythm, and quality. So I'm going to count the amount of pulse, the amount of beat I feel within 30 seconds, and then multiply by 2. Alright, so my patient has a pulse of 70 beats per minute, as well as pulse is regular, but it is somewhat weak. Alright, now I'm going to check the skin condition of the patient. So patient, skin, warm and dry, looking for hydration, skin hydrated, cap refill, less than 3 seconds. So now I'm going to make a transport decision. So I said this patient is not critical, where a patient is stable, so have some amount of time can spend on the scene now. So now I'm going to go into my OPQRST and ask him some more additional information. So sir, you feeling any form of pain anywhere?
Yeah, you pain from my hand. When you drop, you try to balance and you pain from my hand.
Oh, okay, so that's when the pain began, when can you...
Yeah, I'm drop on it.
Okay, alright. Is there anything that makes the pain worse or better?
No, just feel.
Okay, alright. So what about the radiation? Is the pain moving from anywhere else?
No, that's right.
So what about the quality? How would you describe the quality?
It's sticking.
It's a sticking pain. Alright, so on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you ever felt before, how much would you give the pain?
Just give it a 3.
A 3? So it's not that bad. Okay, alright. So what about is it pain? Is the pain constant or does it come and go on and on?
It's just there, because it's just there.
Okay, alright, no problem. So moving on into my sample history now, I would have already get signs and symptoms. So now, hey, are you allergic to anything, sir?
No.
No, okay. Are you on any medication?
Not right.
No, and no medication at the moment.
Not right.
Okay, alright. What about your medical history? You have anything you're sick with or anything like that?
Yeah, I'm diabetes.
Oh, you're diabetic? Okay, alright then. So what was your last meal?
Last night, I'm going from there. Last night, we ran the pressure.
Okay, so from nothing to eat since morning.
They were going to do some work in there.
Oh, and you said event leading up to it, you were doing some work in the yard when you slightly went busy
Yes.
and lost the eating and fell.
Yes.
Okay, alright. Alright, so now, moving from that point now, I will go into doing some set of baseline vitals. So now I'm going to go back into the breathing, checking the breathing. Alright, so my patient has a breathing rate of 20 breaths per minute. Checking back the pulse. Alright, so my patient has a pulse of 70 beats per minute. We'll do a quick temperature check. 97.6. We're going to do a quick blood pressure check. I'm going to do a quick blood pressure check on you, alright, sir? So I will continue to pump the cuff until I no longer feel a pulse and then go over by about 15 or 20 more. And then slowly release, listening for the first beat to the last. Alright, so this patient has a blood pressure reading of 120/85. So now I'm going to also do a GMR check. Alright, so I'm just going to just do a quick GMR check on you. Get my cotton swab, sanitize the finger that I'm going to prick. Then use the machine, join up on the strip. And this patient, I said this patient has a reading of 2.1. I'm also going to do a pupil check. Alright, so look straight towards me. Patient's pupil are curled, pupils equal, round and reactive to light. I'll also do a GCS score for this patient, in which I would give this patient a GCS score of 15. A 4 for spontaneous eye opening, a 5 for verbal command, and a 6 for motor function command. Alright? So now, after completing my baseline vitals, my patient would have alluded earlier that he is diabetic and he also has not eaten anything since morning. So my index of suspicion is that this patient is suffering from hypoglycemia. And in treating that, I will use glucose. So, in using the glucose, I would ensure that it is the right medication, which is the glucose, right patient, a hypoglycemic patient, route, orally, time, I can see that this package is not going to be expired until next year. And the dosage is going to be 15 to 25 grams and make the right documentation. So I would go and put about 25 grams of oral glucose in a container, mix it with some water, and then I would give it to the patient to drink. So you can have this to drink from, sir. Okay, sir. Alright. And my patient would still be on oxygen, and I can see that the patient's O2 saturation has improved. It is now at 98%. So now we can move to the back of the ambulance, in which we are now going to transport this patient. Being that this patient is a stable patient, I'm going to reassess every 15 minutes. And I'm also going to go back over from LOC, coming down, checking the level of consciousness, checking my interventions to see if my patient has improved or decreased. So now, in reaching to the medical facility, I would now hand over the right documentation to the doctor in charge, stating that today received a patient, male patient in his 40s, who was doing some work in his yard and then lost consciousness temporarily. And then I would also mention that the patient was administered oxygen via nasal cannula at 5 liters per minute, and that has helped improve the patient's O2 saturation from a 92 on room air up to a 98. The patient GMR reading was also very low. Patient being a diabetic patient, it was 2.1. Oral glucose was administered, in which after reassessing the patient, the patient's oral glucose went up to 5.5. And then after handing over, we would then return to station. So that would end my presentation. Thank you.